I tried to convince the breast cancer specialists to come together in a physical space for their offices. And I actually did move my office I lived with the medical oncologist over in the cancer building, but the surgeons didn't want to leave the surgeons and the radiologists didn't want to leave the radiologists. And so we didn't completely come together as a group physically. We created a bit of a workaround. We created a virtual integration of those groups by having a centralized office and a centralized number where people would call to make appointments. Like we actually eventually did have a clinic space where all of the specialists see patients together 2 half-days a week. And it has a radiology suite there, which is quite unique to have radiology in a clinic space now. And I think that's important because there, those hallway conversations that happen where you share that spontaneous communication about caring for a patient that would be really helpful and happened in the past. In the past, when you had an x-ray and you had a question about it, you actually would walk down to radiology and talk to the radiologist in person and have a back and forth. Nowadays, with the way practice is designed, there's not the 15 or 20 minutes that it would take to do that. If you're lucky, you can stop and make a phone call.
Having the providers and the patient all in the same area is a help for providers in terms of our communication, and it's also a help for patients because patients then can come in and they can just go to sit in one room and then say if they're coming back, say after their surgery, I can do their post-operative check. They can see the medical oncologist, they can see the radiation oncologist. It's all coordinated, their appointments. They don't have to go, one day this doc, another day this doc, which is what it used to be before we had the secretaries trying to coordinate these appointments.
Between my 2 diagnoses, there was a great transition at Dartmouth-Hitchcock, and the comprehensive breast program through Dale came together, and treatment teams were now in one place every Wednesday. Plastics and oncology and general surgery and an internist, a massage therapist, physical therapy were all in one physical space at the hospital. So I would walk in for an appointment, and it could be an appointment for radiation, or it could be an appointment to follow up on suture removal. And all of these people would flow by, so if I had a question or I had a concern, I didn't have to make a second or a third appointment. They were all right there.